This morning, we are talking about women's healthcare with Oprah Daily. Oprah hosts classes called The Life You Want. They are amazing. That's where she interviews experts and familiar faces about wellness. In a new class, Oprah spoke with Dr. Elizabeth Comen, who specializes in breast cancer for NYU Langone Health. Dr. Comen is also the author of All in Her Head, The Truth and Lies Early Medicine Taught Us About Women's Bodies and Why It Matters Today. In this clip, they discuss shame.
Can you explain to us why the primary emotion for women is shame when it comes to our medical?
Well, I think that the shame really mirrors what women have experienced for so long in society, whether it's how we dress, how we speak, what we deserve, how we want to live, how we want to thrive. And medicine is inextricably linked to the stories that have been told to us and the stories that we tell ourselves. And for many women, including myself, some of that includes stories of apologizing and feeling shame for my own body.
And so even on the deathbed or even in the most serious of illnesses, people are apologizing for it.
Absolutely. I mean, on a daily basis, if I see 20 women in a day and I have to do a breast exam on them, the number of women, when they lift up their arm for me to examine their breasts, will say, you know, I'm so sorry for sweating, or I'm so sorry for what this scar looks like, or I'm so sorry that I didn't shave today. It's like, well, I didn't shave my armpits to come see you. Why do you have to do that for me? Right? Or women going to give birth and feel like the minutes before they have to like run to go get waxed. Why is that? Why are we apologizing for not getting a pedicure when we're sick and we're seeking care? Something is not right there, and narrative has to change.
And that's why we are here. Dr. Comen is with us now, along with Pilar Guzmán, editorial director of Oprah Daily. Thank you both for being here. This spoke to me so loudly because I've done this at the doctor. I'm so sorry I didn't get a chance to do this or do that or whatever. And it's like, I wonder if men, have you ever done anything like that at the doctor?
No. I have, but I'm a special case. And, yeah, anyway, carry on.
Well, talk to us about your work, Dr. Comen, and particularly trying to unravel all of these things that we've internalized generationally about how we approach women's health, even with labels like, you know, women are labeled with being anxious or hysterical. Where does that all come from?
Exactly. Well, the word hysteria, for example, comes from the Greek word for womb, where the idea was that, you know, we were irrational and crazy because our womb wandered all over our body. And of course, once we learned over time that, yes, our uterus is not wandering and that's what makes us crazy, it became estrogen or whatever it may be that was making us hysterical. But it relates to so much of our modern day medicine. It wasn't until 1993 that the NIH was even required to include women in funded clinical trials. It wasn't until 2016 that animal models were required to even include or say that they were using female or male mice.
So how can we understand women's health where we're not really properly studying women's health? Pilar, which I love your name so much.
Thank you for saying it so nicely.
Why was this so important to focus on?
I think that Oprah has always been the leader of convening experts in the fields of all things women's health and mental health. I think that, you know, part of the challenge has been that women don't find their voice. They lose their voice in the doctor's office. And even before they get to the doctor's office, there's so many issues that we just internalize, or we think it's something else, and we don't have the language. So we really need to convene women and let them talk to each other so that they're hearing the same stories and saying, hey, I've got that too, I've got that too. And then you bring that to the doctor and you find your advocacy there.
Dr. Comen, you know, you can be sitting there in the doctor's office. This goes for men and women, but women in particular. A doctor comes in, seems busy, says everything looks fine. You have something you want to say, but you're not feeling like you have the opportunity, or you're not being heard the last time you said it. What advice do you have for women to get across exactly what their ailments are and make themselves heard?
Sure, I see this from both sides of the perspective, as a female patient, but also as a physician as well, and we are partnering with a very imperfect system. One thing I would say is if you're newly diagnosed with something, and especially anxious, bring somebody with you. Bring a list of questions and say, I really am worried about this. Can we take the time to answer it? And also understanding with your doctor, what's the best way to communicate with them? Because often they're working with a big team, maybe a nurse practitioner as well.
Pilar, speaking of bringing somebody with you, as men, oftentimes we don't understand, which is why this book is powerful, because it takes us into the mind and also into those rooms. But if we want to be better advocates for the women in our lives, How do we do that? Not just in the medical space when they are visiting the doctor, but also when we are together, alone. How can we do better?
That's such a lovely question. Thank you for asking it. I think it has a lot to do with just listening.
Okay.
And I think men tend to have they have the tendency to want to solve the problem rather than hear it. And of course, phase one of solving any problem is actually listening, because you can't fully absorb the nature of a problem until you've fully heard it. And I think men get scared and they want to jump to the rescue, and really it's about hearing it.
And there's also documented proof that women, and women of color, Black women especially, are not believed when they talk about their pain.
Yes.
How can, and we just have like 20 seconds, but what can women do to have a better experience?
Well, I think that just understanding to trust your gut, and if you don't like your doctor or feel that you are not being heard, you must find another doctor and have that advocate with you as well.
And we need changes in the system overall in health.
Pilar, that you were spot on about men, by the way. They do want to solve it, not hear it. They had to change that.
All right, well, Pilar and Elizabeth, thank you so
Thank
much
you.
for being here. You can catch Oprah Daily's The Life You Want class at oprahdaily.com right now. We'll be right back.